Somebody is saying, Deb is saying hello from Boulder, Colorado. Deb, hello. Sarah is giving me a compliment. This is so good. Thank you, Sarah. That makes my day. All right. And somebody's telling me that I have question and answer button also. Sarah, I'm sorry. You and I both love coffee, but I think I'm changing my mind about coffee after 10 a.m. What about decaffeinated coffee? Decaffeinated coffee is perhaps better. It has very low amounts of caffeine. There are certain natural alkaloids in caffeine that are beneficial for you, and maybe they will help you improve your cardiovascular health. Okay, so I would say you can do decaffeinated coffee. And Jane, thank you. Jane is telling me that she would want to hear about comparison of different devices. Okay, now I'm at the question and answer screen. The first is a very interesting question. My husband insists that he needs only 5 to 6 hours of sleep, but on weekends he appears to sleep 7 to 8. His job is incredibly stressful. I wish I had an effective argument for helping him get more sleep during the week. So, Deb, this presentation will be on the web at IDM website. I hope you can give it to him. You can hopefully make him buy a sleep tracker. If he's sleeping 5 to 6 hours and his resting heart rate is high, his heart rate variability is low. If he is not getting enough deep sleep and REM sleep, and when he compares that with his responses during the week, he might get convinced and say, look, sleep is important. Also, you may want to talk to him and find out if he's taking any medications for blood pressure, if he's a pre-diabetic, if he's overweight, if he's athletic and he wants to improve his athletic skills. Studies have shown time and time again that sleep before an athletic performance is necessary for good performance, and sleep after an athletic performance is important for recovery. Sarah is asking a good question about high testosterone levels. Do they affect the amount of sleep? I'm not sure. I'd have to look into that. How can one sleep without medications if there is chronic pain? This is an anonymous person, and I'm glad that they are anonymous. Chronic pain is a very common condition, especially, I would say, I am somebody with boots on the ground. I see patients in the hospital and in the office. About 20 to 25% of admissions to the hospital with chest pain and abdominal pain are related to chronic pain. People who have chronic pain, they come in because they're not able to manage their pain well, and it manifests as either chest pain or abdominal pain or some other complaint. And definitely it disrupts sleep. So you need to go to a specialist, and unfortunately there are not very many. The opioid crisis in the United States is a big example, because the medical profession has been incentivized to prescribe pain medications. We have not been incentivized to tell you how to deal with chronic medications, with behavioral therapy, with other ways of finding out why you are having chronic pain and how to reduce chronic pain. So there is no easy answer to that. And of course, I know that your sleep is going to be disrupted. But even if you have chronic pain, sleep that you get with the aid of medications is not going to be restorative for you. So you need to be careful about that. Steve is asking me, what is your prescription for a 68-year-old runner with 30 years of running and now a CAC score of 800? So Steve, that's a good question. Can I still ride my bike and my mountain bike? So first of all, you need to see a physician and make sure that the score of 800 is not causing any restriction to blood flow. So I would recommend that somebody like you should get a good stress test. The second thing is that the calcium levels may be higher in people who exercise compared to people who don't exercise. Now, I used to be somebody who was of the concept that exercise was one of the best things one could do, and the volume of exercise did not matter, the intensity of exercise did not matter, that you could exercise from one day to the next. I used to cycle about 250 miles. On the weekends, I would go and do a 50 to 75 mile bike ride with my competitive friends, in which I would run my heart rate to about 150 beats per minute average for 3 hours. And I think I was wrong, because my exercise was not guided by recovery. But now my exercise is guided by recovery. If I do a high intensity exercise one day, I'm watching my resting heart rate. If my resting heart rate is high, if my heart rate variability is low, then the next day is either a rest day or exercise for very short duration at low intensities. I think one of the reasons why people who exercise get into trouble in terms of coronary calcification or plaque buildup in the blood vessels of your heart is because we are not paying attention to recovery. We are in a high sympathetic arousal state, a fight or flight response. We have not calmed our heart down. We have not reduced our adrenaline levels, the fight or flight hormone. So, Steve, exercise is highly important. Exercise helps you sleep better. Exercise improves your insulin sensitivity. Exercise improves your blood pressure. However, I have gone now to saying any amount of exercise is good, to now talking about exercise with the concept of exercise optimized by looking at objective measures of your recovery score. How well you slept. What's your resting heart rate? What's your daytime heart rate? What's your heart rate variability? How do you feel? I want to put all of these together before I give you an exercise prescription. Now, Cindy is saying, not sure if this is the scope of the presentation, but wondering if you might explain what is an abnormal lab test from CRP high sensitivity could indicate. Good question. A high CRP is an indication of inflammation. I would say the lower it is, the better it is. I like numbers that are less than 1. Some people consider 3 to be the upper limits of normal. So a high CRP is a marker of inflammation. You need to look in and see what is causing that inflammation. Is it chronic infection? Is it metabolic syndrome? Is it insulin resistance? Is it some form of arthritis? So yes, a high CRP is kind of a dummy light in your car that says something is wrong in the engine. You need to go in and evaluate it. But it's a pretty good warning light that you should pay attention to. Somebody is asking whether cannabinoids, that is the compound that people smoke in marijuana, does it do the same thing as alcohol does? Not sure. I don't know that, so I don't want to speculate on that answer. Another anonymous attendee saying, my blood tests show very high cholesterol reading. What causes excessive cholesterol in the blood, and is it dangerous? Well, that's an exhaustive question. I would recommend to this attendee to put my name in YouTube, Nadir Ali, MD. I must have 5 to 10 good talks on cholesterol. You need to get a primer on cholesterol. Briefly, I talk about cholesterol quality. Good quality cholesterol is when your triglycerides, that is fat in your blood, is low, when your HDL, when your good cholesterol is high. And I stray away from my colleagues from mainstream medicine, in whom I think that when triglycerides are low, when HDL is high, the high LDL is not a problem. Do I know that answer for sure? I don't know. I have made some persuasive arguments that you can look into for a detailed answer. All right. Dr. Ali, how many fasting program patients, when they are doing longer than 48 to 72-hour fast, report bad quality sleep on night 1 and 2 of the fast? Can you please explain why this happens and offer tips on how to achieve better sleeping while fasting? So this is asked by my very good colleague who is a fasting coach, Nina Silva. And Nina, thank you for that question. And I really had not paid attention to why sleep goes bad until I started investigating sleep with fasting. Apparently, prolonged fasting can induce a stress response in your brain. And the stress response in the brain can reduce the quality of your sleep, both the quality of your deep sleep and your REM sleep. So I don't have enough information on that. A substantial proportion, I won't be able to give you a percentage, but a substantial proportion of our patients do tell us that sleep quality gets pretty worse, that they sleep less and less as the fasting gets more and more prolonged. So it's not only just the first and second day, but they really feel like they are not sleeping much, although some participants come back and tell us that they slept a short time, but they felt that it was very restorative and deep sleep. I think that I would like to reach out to Will Ahmad. By the way, Will Ahmad is a young man. He's the founder of the Whoop band. And I have no relationship with Whoop or with the Aura Ring or with the Fitbit Sense. None of them pay me any money. So it's not like I would like to recommend one over the other. But I would like to put a Whoop band on people who are doing fasting and figure out how well they are sleeping, what's happening to their heart rate and heart rate variability. But what I wanted to tell you was that the company founded by this young man is extremely amazing, because how they take the data, your sleep data, your heart rate data, your temperature data, your breathing data, and the analytics, how they analyze it and present it to you is far superior than what an iWatch can do, what Fitbit Sense can do, even though these are much larger companies, or even what an Aura Ring can do. I would say the Aura Ring comes pretty close in terms of competing with the Whoop band. And I think that Will Ahmad would never see this podcast and he would never contact me. But I want him to contact me if possible and start a program in which I can monitor people on a Whoop band who are fasting and who are in our lifestyle coaching program. So I want to take a few more questions. I want to end at 7 o'clock because I want you guys to come back. I'm so happy that there are 71 people attending. So Deb is asking me, regarding heart rate variability, how useful is my Fitbit for tracking this? I'm currently hooked up to an EKG on a daily basis for my EECP procedure. Would there be anything interesting to learn from the time prior to starting the external counter pulsations? So Deb, Fitbit gives the heart rate variability too. It is perhaps comparable to the Whoop band and to the Aura Ring. It calculates the Fitbit, it calculates the heart rate variability as a metric called root mean square of the difference between RR intervals, RMDSS. And so whenever you take a device, you want to make sure whether they are calculating a different metric of heart rate variability. I would say that Fitbit is perhaps comparable, but it's a little difficult to find where they embed that heart rate variability data in. And it is difficult to evaluate from them what your recovery score is after an exercise. For you, since you go through EECP, you may want to see on the days that you go through EECP, whether your resting heart rate is low, whether your heart rate variability is better. and compare that with the non-EECP days and see if there is any difference. All right, so Deb, different Deb, is asking, I generally exercise 60 minutes between 6 and 7 p.m. and is this an impediment to good sleep since it is at night? I would say perhaps, I'm not sure. If you are exercising at 6 to 7 p.m. and you're sleeping at 10, that's a time difference of about 4 hours, 3 to 4 hours. That might be enough for your core body temperature to come down. That might be enough for your stress hormone, the adrenaline levels to come down. You would just have to compare yourself. You would have to try a time in which you are exercising in the morning and measuring your metrics, your sleep metrics, and seeing what's happening to your sleep metrics. Another thing that you may want to figure out is that, are you doing exercise at the same intensity every day? And are you giving your body time to recover? In other words, are you monitoring your metrics? Is your exercise optimized? And that, is it giving you a chance to recover, or you're going from one exercise session without recovery into another exercise session? So a couple of my very good friends, Mike and Nancy, are asking, if I already sleep 10 to 12 hours per day, what does that mean? And what I want to tell them is that it's good that you're sleeping 10 to 12 hours per day, and that's a good question, and it might be a good question to end on. It's very important to differentiate between time in bed and actual sleep. So in other words, let's say I give myself a sleep opportunity now of between 8.5 to 9 hours. So as you get older, your sleep efficiency goes down. So, you know, at age 50, a sleep efficiency of about 85%, 80 to 85% is very good. There is a patient of mine, Lisa, who's had high cholesterol for about 7 years. She's got a calcium score of 0. She's focused on sleep. Her fat cells are very healthy. She's in her 50s. She has a sleep score of 90 on the Aura ring, which means that her sleep efficiency is better than 85%. Now that's an unusual case. Usually sleep efficiency is about 70 to 80%. So that means that in order to get 6 hours of sleep, you may be needing to be in bed for about 8 hours or longer. So you should give yourself a sleep opportunity that is consistent with the sleep efficiency that you have. And as your sleep efficiency improves, you can reduce your sleep opportunity. And in order to improve your sleep efficiency, you should do all the tricks that I talked about. So Mike and Nancy, I'm glad you sleep for 10 to 12 hours, but I think that you need objective data. You need a tracker. You need to figure out what duration of time during that 10 to 12 hours you're awake, and how good is the quality of sleep, and all the other metrics that go with sleep, including your body temperature, your sleep, your respiratory rate, how well are you breathing, your resting heart rate, your daytime heart rate, and your heart rate variability. So I'm sorry, I did not get a chance to answer many questions. I hope it was useful. I'm trying not just to focus on fasting and cholesterol and low carb diet and nutrition. I want to focus on all 4 pillars of health: intermittent fasting, nutrition, exercise optimized by recovery, and sleep. So thank you. I'm going to end the session here. And I will keep in mind that I'm going to give a review of the devices. Thank you.